My name is Ashley Palmer. I'm a nurse practitioner student at Clemson University, and today I will be presenting a case. Mrs. Banks is a 69-year-old white female that presents today with complaints of congestion and a headache. This started 2 weeks ago and it hasn't resolved. She's also had a cough with some mucus production, some nasal stuffiness, and some drainage. She states that she has pain under her eyes that is a 4 out of 10, and the pain is worsened when she bends backwards. She has tried some Alka-Seltzer, cold, and flu at home with no real improvement. She denies any fever, sore throat, wheezing, muscle aches, nausea, vomiting, diarrhea, decreased appetite, no recent facial trauma, shortness of breath, dizziness, or chest pain. She is a generally healthy woman with no prior hospitalizations or surgeries. She does have seasonal allergies. She is postmenopausal and does have insomnia. She is married and retired. She denies any illicit drug use, tobacco, or alcohol use. Her only allergies are to penicillin. She takes a Benadryl at night occasionally just to help her sleep. And today she appears well nourished, alert and oriented ×3. Her blood pressure is 124/78, pulse is 88, respiration 16, and a temperature of 99.7. She does have some pain and tenderness upon palpation to the frontal and maxillary sinuses. There is no periorbital edema noted, and her facial expression is symmetrical. Her pupils are equally round and reactive to light and accommodation, and the conjunctiva are clear with no drainage. Her neck is supple with no lymphadenopathy. Her nares are patent. There is some redness noted to the nasal mucosa and with edematous turbinates. She does have some yellow nasal drainage, but there is no septal deviation noted. Her TMs are dull but intact bilaterally. The light reflex is noted and no effusions are noted. The oropharynx is slightly erythematous. The uvula and tongue are midline with no swelling, and her teeth are in good repair. Her lungs are clear to auscultation. She has a regular heart rate and rhythm with no murmurs. Her abdomen is soft and non-tender. She does have positive bowel sounds in all 4 quadrants. The differential diagnoses for her today would be sinusitis, viral upper respiratory infection, migraine, dental abscess, allergic rhinitis, and trigeminal neuralgia. No diagnostics would be needed at this time. We would diagnose her with sinusitis based on the length of time of these symptoms, which was 2 weeks, and based on her physical exam, which shows she has the yellow purulent nasal drainage and the facial pain. Due to her penicillin allergy, I would prescribe her with doxycycline, 100 milligrams to take by mouth twice a day for 10 days. I will also recommend her to use some nasal saline spray, 2 sprays to each nostril as needed, just to decrease some congestion and promote drainage. I will also recommend using over-the-counter Mucinex to thin some of the mucus, and ibuprofen to use as needed for discomfort, and not to exceed 400 milligrams in 24 hours. I would encourage her to follow up with the staff for any worsening symptoms or no real improvement on the antibiotics for 72 hours.